In many cases, medicine is all about the money, and this is one of those cases. So I think a scribe is a wonderful idea, actually, because if you have a scribe, you can just talk to the patient, and in the background, your scribe is taking notes, constructing the progress note or the history and physical or whatever. And then after you're done, you just tell the scribe what you need to do in terms of orders and follow-up, and the scribe takes care of it. It's awesome. Now, I've never had a scribe because when I was in Southern California, I was an employed physician, and that was not one of the options that was available. I was actually in a leadership position in my department, and I tried to get a scribe from one of my physicians because this physician had a little bit of thumb problems that actually made it really slow and difficult to take notes. But I tried to wade through the layers of bureaucracy to justify the cost of a scribe for this physician for months, and I just hit a wall and I had to give up. And that's one of the problems. If you are an employed physician, even though it's perfectly obvious that you would see twice as many patients with a scribe and your life would be way better, unless you can justify it and make sure and convince people that it's going to be cost neutral, it's really hard to do something like that. It all comes down to autonomy. I know a lot of physicians in private practice who have done the math and they figure that they'll be X times more efficient with a scribe, so they get a scribe and it makes sense and they can pay for it and it's done. But most physicians now are employed and that power is not in their hands, so it comes back to autonomy. So hopefully fairly soon this will all become a moot point because really good AI systems will just take this problem away from physicians. But until then, note-taking and problems with the electronic medical record are going to continue to be a point of contention for a lot of physicians out there. I'm Dan, the No Doctor. I'm a urologic surgeon, real estate investor. Follow for more.